Hey there, I'm Carly. Welcome to a special edition of A Health Coach Explains. In today's video, we're going to walk you through what it means to be a health coach, and for those who are interested in pursuing this career path, how to become a health coach yourself. So, first, let's start out by answering some of the most common questions, such as, what is a health coach? And how does this differ from other healthcare professionals? An easy way to tackle this is to first tell you what a health coach is not. A health coach is not a medical doctor, mental health professional, or a nutritionist. While a health coach's work combines aspects of all these fields, helping individuals gain clarity and make healthier improvements in their physical and emotional health through diet and lifestyle, a health coach does not prescribe, diagnose, or treat any medical or psychological condition. Nutrition education and empowerment are cornerstones of health coaching, which is why sometimes health coaches can be confused for nutritionists or registered dietitians. In fact, the reasons why someone may seek out either a nutritionist or a health coach may be similar. Weight loss, reversing an illness, coping with a life transition, improving energy and mood, and so forth. To be a nutritionist, one must complete several years of formal training at an accredited institution and earn a master's degree in nutrition, as well as complete 1,000 hours of clinical supervision. Nutrition services are often covered by insurance, and doctors often refer their patients to nutritionists to help get medical conditions under control through dietary interventions. A nutritionist may prescribe specific meal plans and dietary protocols to their patients based on their lab tests and medical diagnoses. A health coach can earn their credentials from a reputable health coaching school, with most health coaching programs taking between 6 months to 1 year to complete, but some may require less or more time. A health coach has a wealth of knowledge about nutrition. However, when a client works with a health coach, all dietary modifications are client-led, meaning the coach will help a client explore different dietary theories and protocols they're interested in trying. But a coach will not prescribe any specific diet or attempt to interpret lab results or formulate a meal plan based on them. Instead, a health coach can help the client explore their ailments and symptoms and help them get to the root cause of what may be troubling them. From there, a health coach can educate the clients of the potential benefits and harms of certain foods, always keeping bio-individuality in mind, which means letting the client decide what feels right for them and their unique bodies and goals. Many coaches do well by working in conjunction with doctors to help their clients implement lifestyle modifications that work for them. Unlike nutritionists who focus solely on the dietary aspects of health coaches take a holistic approach to health with their clients, understanding that diet alone is not enough to attain health and happiness. Here at IIN, we refer to this as primary food, everything that nourishes us off our plate. Health coaches provide a safe, non-judgmental space for clients to be heard in their fullest as they explore different areas of their lives, such as career, relationships, spirituality, physical activity, using active listening skills. Coaches also use evidence-based strategies to effectively motivate clients to make behavior modifications that will allow them to make and stick to healthier choices. Coaches empower, support, and cheer on their clients along the way, while also providing ongoing accountability. Coaches help formulate action plans for their clients and help them work through setbacks that inevitably come up on the road to healing. Many health coaches work with their own niche. For example, helping busy parents regain energy, or helping those who struggle with weight management. So what does this look like in a real-world setting? Here's an example of health coaching in action for a coach whose niche is helping people naturally balance their hormones. Your client Susie comes to you because her doctor just diagnosed her with estrogen dominance. Her body is producing too much estrogen and not enough progesterone to balance it out. Susie's doctor tells her that one way to get her hormones back in balance is to take certain medications. Susie is wary of taking medication right away and wants to explore other ways to get her body back in balance. As a health coach, you're armed with holistic approaches to balancing hormones. For example, you know that healthy liver function is essential for detoxification of estrogen, so supporting liver function with plenty of whole foods, especially cruciferous vegetables, can help. By working with Susie to crowd out some of her processed foods with more nutritious liver-supporting foods, her liver function can improve, helping her hormones to stabilize. You also know that cortisol, the stress hormone, can interfere with the production and function of other hormones. While working with Susie, you can help her uncover hidden stressors in her life that help her brainstorm stress management techniques that she can implement into her daily life. Before exploring this area with you, she never really realized how stressful her home life was or how much pressure she felt from her job. Her high stress levels are likely contributing to her hormonal imbalance. By giving her a safe space to explore and articulate these aspects, she can start to take control and make healthy changes. Tuning into Susie's bio-individuality, you don't assume that yoga and meditation will work for her to reduce her stress, just because it's helpful to others. You take the time to ask high-mileage questions and find out that Susie loves to walk in the park when she has time because it relaxes her. So you encourage Susie to block out time to walk every day, not just when it fits into her schedule. Finally, as a health coach, you are aware that certain chemicals found in home care products and plastics contain xenoestrogens, synthetic estrogens that can interfere with natural estrogen in the body. By educating Susie about these chemicals and helping her make a few simple swaps to her personal care products, you help Susie limit her toxic exposure, which will have a positive effect on her hormone balance and overall health. Do you see how a health coach does so much more than just recommending a diet or lifestyle change? Health is multifaceted, and without addressing the whole person, health issues are likely to continue. Health coaching is client-led, with the understanding that the client is the best expert on themselves. So if a client comes to you and says, "I heard grains are bad for you. Should I stop eating grains?" You can first help the client explore why they want to give up grains, and then ask what they think is the best course for them to take. While it's good to encourage clients to explore small dietary modifications, such as eliminating sugar for a specific period of time to see how they feel, a coach should never suggest that a client make any big, permanent dietary modifications without consulting with their doctor first. And that's what's great about health coaches. They can work in conjunction with doctors and nutritionists to help keep the client safe while staying within their scope of practice. So when your client asks if they should give up grains, instead of saying yes or no, a coach might say, "It sounds like you're curious how your health would improve if you eliminated grains for a while." For some people, grains can have a negative impact on their health, while for other people, whole grains are a wonderful source of vitamins, fiber, and other nutrients. It's all highly individual. I'd encourage you to run this by your doctor, just to make sure there wouldn't be any potential harm in removing grains from your diet. Health coaching is a wonderful profession, which is gaining more and more attention, as the current healthcare model doesn't have the resources or time to address patients holistically. Health coaches are able to fill in those gaps, which is why many doctors employ health coaches in their practices. If you're interested in becoming a health coach, here are some key things to consider when searching for a training institution. Number 1, consider your education goals and how you'd prefer to learn. Do you prefer a slower paced program or one that gives you a lot of content every week to study and practice? You may want to look for a training program that offers different options. For example, here at IIN, we offer our Health Coach training program as a year-long course, or for those whose students want to take on more and graduate sooner, we also offer an accelerated 6-month course. Number 2, next, figure out what you want to learn. Spend some time researching the curriculum of the training program. Who are the teachers? Will you be learning more nutrition content, coaching, health coaching business skills, or all of the above? See what's offered. Number 3, scope out programs that are credible. Seek out testimonials, speak to graduates of the program, and consider their reputation. IIN has been training health coaches for nearly 30 years, with over 100,000 students and graduates in 175 countries. Also look for licensure, partnerships, and affiliations with organizations that recognize the program for its high-caliber education. IIN is a licensed vocational school, and we're partnered with organizations in the US and internationally that provide our graduates with personal and professional development opportunities. I hope this has given you a little more insight into what a health coach is, how it differs and complements other medical professionals, and how you yourself can become one. We'll provide some further resources in the description below to learn more about becoming a health coach. If you have any questions or comments, let us know in the comments below. We'd love to hear from you. Thanks for joining me, and we'll see you at the next A Health Coach Explains. Hi, YouTube family. Please like and subscribe so you don't miss out on a Health Coach Explains videos each month. And to learn about becoming a health coach, check out our website in the description below.